Hello everyone, my name is Dr. Aaron Marks. I'm from Smiles and Matthews in Hudgens, Virginia. Today I'm going to be answering some questions in regards to crowding of teeth. So crowded teeth is a developmental issue. So it's how we grow, how our skeleton grows while we're children, and then the teeth follow where the skeleton is. If for whatever reason, the jaw, lower or upper, don't grow at the same rate as the teeth coming in, there's not going to be enough space, so the teeth will find a way usually to come in, whether that be outside, inside, rotated, however that may be. And there are some theories that can be contributed to not very good nutrition as either a baby, child, adolescent, however. I don't know how substantial that is, but I have read some scientific research that points kind of that way. It can also be genetic. It's all just the difference between those three are the severity, obviously. So mild, you're going to have some crowding. You can probably get by just fine. Most people actually have crowding to some extent. It can be all the teeth. It can be just the front teeth. It can be one side versus the other. Anywhere in between there. Mild, so that would be mild. Moderate, we're looking at more, you're getting areas where food is getting stuck, it's hard to clean, stuff like that. Severe, that's where you're going to have to get braces or Invisalign, something like that. And depending on that severity, braces can be more beneficial or more, they're both beneficial, but more controlled. I don't know if there's much difference. The bottom teeth, when the bottom front teeth, those are the smallest ones in the mouth. And so when they crowd, the amount of bone that's around them will be less. And so they can be more compromised as far as possibly losing them in the future if that's not addressed early on. Not necessarily. Everybody's different in the situation. So the first best option is braces. Second option would be clear aligners like Invisalign. There are a couple of other companies out there. Those are pretty much the only way to address that. Sometimes, rarely, some teeth will have to come out in order to give enough room for the remaining teeth to find a space, especially if you're no longer or it's non-adolescent and they're still growing. Your bone's not going to grow anymore, your jaw's not going to get bigger. So in severe crowding cases, usually removing some teeth is necessary. So crowding is something that you grow with, and so your body gets used to it. Really severe cases, it's hard to eat, hard to chew. Speech can be impeded. Breathing can be impeded because the airway, that's the beginning of the airway, and if it's constricted, it can affect that. So again, everybody's different as far as how long it's going to take. A lot of times braces can be a year up to 4 years. So it really depends.